I wish that this type of experience and the rationale behind it, the tie-in with the hormonal changes, I wish that there was a class or something that we had to take as women at some point in time, well before this starts kicking in, to say, hey, plan ahead. At some stages in your life, these are some things you can expect. It's normal. You're not failing as a person. Here are some things you can do to improve your insulin sensitivity, increase your energy levels, get better quality sleep. These symptoms, there's a whole bucket of them. Take a look through. If you start noticing them, go ahead and reach out to these types of doctors, because this is the other gap is once you start
It's
noticing
a
these
huge
symptoms,
gap.
who do you talk to?
Welcome to Think Like a Pancreas, the podcast, where our goal is to keep you informed, inspired, and a little entertained on all things diabetes. The information contained in this program is based on the experience and opinions of the Integrated Diabetes Services clinical team. Please discuss any changes to your treatment plan with your personal healthcare provider before implementing.
Welcome to the IDS podcast. My name is Paula Diab, and I head up the weight management division at IDS. Today, we're going to be talking about menopause and perimenopause. Combining that with weight management is particularly challenging, but maybe we'll touch on that a little later. But I think we wanted to focus more on the hormones and the way that our bodies change during menopause. And just before anyone imagines us sitting here with knitting needles and cups of tea in a very quiet life, that's not what menopause is about. I know when my gran was my age, going on 50, that's what she would do. She would sit at home, she was knitting and sewing, and she would always have the kettle on, and her life had a very gentle pace. But if we fast forward to today, I think Dana, Tavia, Jenny, myself, we all have very, very busy lives. We've got children still at school or at college. We've got full calendars, demanding jobs, busy workloads, and life is very different. And then on top of that, we're trying to manage diabetes or other health issues. So I think that's what we're going to chat about today, is how do we put all these puzzle pieces together, and how do we balance our careers, work, family responsibilities, and our own personal interests. So I think I want to just hand over to each of them to introduce themselves briefly, and then we can dive into this topic and try and understand and unpack what the women's actually do in menopause and how they impact on diabetes management. Jenny, you want to get going?
Sure. Jennifer Smith, registered dietitian and certified diabetes care and education specialist. I'm the director of lifestyle and nutrition. I work in a lot of the women's health within our practice at Integrated Diabetes. And this is a topic that has become more visible with the clients that we have the opportunity to work with in terms of navigating with diabetes, all of the changes that the hormone shifts bring. So I'm excited. I've been waiting to chat about this with everybody. How about you, Dana?
Yeah, I'm Dana Roseman. I'm the Director of Technology and Applied Research for Integrated Diabetes. I'm also a registered dietitian and CDCES. And I also think that the elevated attention to perimenopause and menopause, specifically with type 1 diabetes, is, maybe people didn't flourish as long and as well as we are doing in the past. And with, new technologies and medications and insulin, I expect to be in my next stage of life, for equally as long as my first part, and doing it, with a lot of enthusiasm and energy. And I think it's exciting to dive into it with you guys, and excited to talk about it.
I'm Tavia Vital. I'm a registered nurse and certified diabetes care and education specialist with Integrated Diabetes Services. And I am the director of intensive diabetes management, which just means I work with people across the lifespan, especially people who use insulin for their primary therapy, for their diabetes management. And yeah, so this topic is one that is of high interest to me personally because of where I'm at in my cycle of life with managing type 1 diabetes, but also because, like Jenny mentioned, work with so many clients that come because when you hit perimenopause, your monthly cycle hormones start fluctuating so much. All different hormones influence glucose management and insulin needs. And you can't see them. You don't have a home measurement kit that you can see, like, how are my XYZ hormones doing this morning? That's why my glucose is doing this weird thing. It's like somebody comes and throws a wrench in the machine of your well-oiled diabetes management plan, and you feel like you're your wits are just coming unraveled and you feel like I've been doing this diabetes thing for a long time. I should have my stuff together. What is happening to me? And it's such a common reason that people make visits with us that we started talking amongst ourselves quite a while ago about these transitional time periods of getting into perimenopause and then what happens to diabetes management at and after menopause. And so I'm really excited to be here today too.
I think we even talked about the desire for a continuous glucose monitor of hormones versus just glucose, and that would be fantastic.
It would be amazing. Feel like,
Be amazing.
progesterone
Like, oh,
today.
it's an estrogen day, or yeah.
Right. Yeah.
Where did my testosterone go? Who knew I had testosterone? Where did it go?
Exactly.
Right, right. I think you touched on something really valuable too, Tavia, is that a lot of times we've figured out our management, right? To a point of, I know how to dose for this. I know how to cover this. I know how to adjust for this exercise. And then even around hormones, if you've been a woman who has paid attention to the natural course of this hormone impacts my blood sugar in this stage of my cycle, I need more insulin or I need less. You might have an insulin pump or a dosing with injection strategy that goes up or down, and you have it. It's like a schedule and you can follow it almost to a T. And then perimenopause comes in the picture and it
throws it all out the window.
Right. It's like a house of cards, really. It's kind of how I feel. Like you've got it built, but then somebody comes and nudges the side of the card table and it's all disrupted and there's no way to rebuild it like it was.
And there's no way to plan sometimes also, right? Because it is just every day is a little bit different, especially in the crazy wackadoodle stage of perimenopause where, sometimes your cycles might be 28 days. Some days they might, some months they might be 35 and you just are trying to whack-a-mole, right?
Yeah. Right. Sure. Yeah.
And I think, like, especially if you think that, especially if you've got type 1 diabetes, by the time you get to your 50s, you've had type 1 diabetes for some length of time. And so a lot of people feel like, I've actually got this. I know what's going on, as Jenny says, like every month, this is what happens, this is what I need to do. And suddenly perimenopause comes along and maybe your progesterone levels start dropping first, and that's going to affect your insulin resistance. And then the estrogen levels start dropping, and then the estrogen starts fluctuating, and then it's high, then it's low, and there's suddenly no more stability to it. And all of that impacts on your diabetes management. And my experience is a lot of patients suddenly feel like, I'm not doing this right, I'm getting it wrong, this is my fault. And I think that's I think we need to change.
Yeah. It's I think too, from our standpoint, we're all diabetes educators. And I know my own feeling is not so much like anger at diabetes. Mine is that something in my body is like failing me again. And it really, from a mental standpoint, where a lot of the hormones impact your mental health too, it's a frustrating level to bring in, having the knowledge base that we all have and not quite, it's almost like just getting the tip of the tail of something and then it like slips away again. Like you
and
finally,
feeling like you have to relearn everything that you've already known and worked really hard to figure out and then relearning it again.
Right. In the midst of, by the way, this stage in life where we're the sandwich generation, right? So if we have children and spouses, we are managing that and our careers and helping with older parents or other family members. And so there isn't enough time in the day to really study. We're talking about it in a very studious way, right? We have this background knowledge. We've been researching, right? We've been coming across this topic and learning, right? But in the moment when it first starts happening to you, you cannot pinpoint it. You cannot say, I am this age, therefore it is perimenopause. And this weird thing happening to my diabetes is likely a direct result of progesterone fluctuation. No, because we had 8 soccer games and I had to take a parent to 2 doctor's appointments this week and I had to go to my endo and I had to stay late at work early one day this week. And like, I don't even know which way is up. So it's probably my fault. Right.
It just becomes part of the chaos. And I think that's where so many women feel just deflated with their diabetes journey. And also, Paula, you had mentioned at the beginning of the conversation where weight management becomes an issue. And I think so many women just blame themselves, I ate a little extra cookie or I'm not exercising as much as I need to and not recognizing that it's all part of a full picture.
Right. Yeah. Paula, you mentioned too in the beginning what you saw your grandmother how she was navigating, right?
Yep.
A very calm environment, knitting, drinking tea.
That sounds lovely.
It sounds like she's probably
Yeah,
sitting
go
in a
to a nice
beautiful.
early afternoon after school and have a cup of tea and some sandwiches
Oh my
with her.
goodness, how
Right.
wonderful.
But and then Tavia, you bring in like this, we're in this sandwich like generation, our age specifically, where many women have kids, many don't, but if you do, it adds that layer of you're supporting. And then there's also the parents that we might be navigating who are older age, who may have some things that we have to help them with as well. It gives us less room to look at and evaluate. And as you said, we may miss that first trickle of change, just chalking it up to most women somewhere from about 40, 45 into like 50, 55. This is like the peak of a career if you have one. This is like where you are like, you're in the mix, like you are top of your game and you're plugging along, and then there are all the other pieces, and then there's diabetes too, which sometimes then gets shoved to the corner because you don't have time to sit down and look at your data and see, is there a pattern? So I would much rather have your grandmother's tea.
But I think another challenge with menopause and perimenopause is, we've been describing all these changes that occur, but they happen, and then maybe they happen for a few weeks, and then things go back on track again as the estrogen and the progesterone level, especially estrogen, as it fluctuates. And, so you make some decisions and you think, okay, well, I don't really have time to sort this out, and you're tending to parents and whatever else you're doing. And then suddenly it all comes back on track, and and then you ignore it for a bit, and then you go back to, then it's all out of whack again. So I think it's this constant fluctuation that makes it so challenging.
What do you think about the common symptoms, I guess we would call them, that come about? I think the biggest one most heard is really the hot flashes. Those are the most common that you hear about, and maybe sleep issues, or maybe changes in sort of your ability to navigate frustration, kind of the ups and downs in just personal mental ability to focus on things. But there are many different types of symptoms. So Paula, in the hormones, how do those symptoms equate to hormone fluctuations? And then because all those things are variables in the life of somebody with diabetes, how do we navigate all that?
Estrogen helps to regulate your menstrual cycle, and that's the key hormone in reproduction. But it also supports insulin sensitivity. So as soon as your estrogen starts going up and down, that's going to affect what your insulin demands are going to be like. And it assists with the glucose uptake in the cells as well. But it's got multiple other effects. It protects bone density. It supports cardiovascular health. It influences your mood, as you said, your sleep. And I think a lot of those symptoms that you're describing are very vague symptoms, actually. Are you not able to deal with life's troubles and tribulations because you've got lots of things going on and you had a stressful day at work? Or is it because your estrogen levels are going up and down? I had a really funny experience before I started taking a hormone patch, that my husband kept telling me that I was grumpy, and I wasn't. I forgot what he actually said to me. He didn't say I was grumpy. He had some other term for it. It was slightly less.
Maybe more off color.
Yeah. So anyway, that's what he told me. And I adamantly told him, no, I'm absolutely fine. There's nothing wrong with me. And then for me, with sort of the light bulb moment for me was, I was seeing a patient in my rooms the one day, and the patient left, and he was about to close the door. And I wanted to tell him, you could leave the door open, like I'm going to come out now, and there was someone else coming in. But I've forgotten the word for door. So I was sitting there pointing to the door going, you can leave and the only thing I could think of in my head was the rectangular wooden object with the handle on it. And I thought, I can't say that because he's going to think I'm daft. But then as time went on, it's like 3, 4, 5, 10 seconds that it's taking me to find this word in my head. I can just see this man looking at me going, are you completely bonkers? Like, what are you trying to say? And then eventually I got the word door, and I said to him, you could close the door. You could leave the door open. And he looked at me as if to say, seriously, is that what you were like struggling with?
We're going to give him the meaning of life.
I started worrying that I was getting dementia, right? Because there's a higher risk of dementia and Alzheimer's for people with longstanding diabetes, right? And it runs in my family. When my grandparents get into their late 80s to early 90s, which is not where I'm at yet, thankfully, not there yet. I shouldn't be having these symptoms yet. I was having word finding problems majorly. And you can tell I'm a talker, right? I like to talk. So to stop and be like, rectangular object with the round knob on it, like, all the time, something was wrong. And I wasn't sleeping very well. I have not slept well for a long time because diabetes wakes you up. I have diabetes. My son has diabetes. Chances are high. Somebody's alert, whether it's a true alert or a fake low alert
Right.
from a faulty sensor, somebody's alert might be going off. The dog might have to pee at 4 a.m., right? So there's all these other interferences to sleep. But all of a sudden, word finding, fatigue, I was realizing how many times a night I was waking. And I was like, okay, this is different than it was a year ago. Something's wrong with me.
Mhm.
That's how I started on this journey.
Yeah, the sleep and the word finding, more so the sleep. If I had a complaint about it, at this point, like, I'm not warm, hot, cold. I just am normal body temperature. Thank goodness. It's the sleep disturbance that's the most annoying to me, because I used to be, even with having kids, I used to be a really good sleeper. And that is my biggest frustration at this point. And I've equated some of the lack of sleep stuff to the word finding stuff. I'm like, oh, clearly I'm just tired. But, again, in talking to other women, it's really helpful because then you feel less crazy.
But I do
Reading.
think there's a domino effect, right? You're not sleeping well. So then maybe your workouts aren't as effective or intense. And that's really where I noticed that my energy level was just not as high. I'm typically a go, go, go kind of person. And noticing that I just wasn't putting in as much effort as felt comfortable for me, and not necessarily sleep related, just a sense of just fatigue overall.
That
Yeah.
too. And I have multiple autoimmune diseases. So I couldn't just say, well, this is something totally new for me. But it
Right.
was more persistent, and it was just kind of gradually getting worse and worse with nothing I could think of to do differently to make it better. And my weight was going up, which I'm not
It's
eating
almost
as
like
healthy.
your body composition changes because your hormones are
Absolutely.
shifting, and those are
Yeah.
so important to the shape of a woman. And as those hormones change, that's something that when I tell women that, I feel like there's a light bulb moment that comes off, because they feel like, "Oh, this isn't just because of lack of effort or any
Right.
feeling of shame that I should have." But, really talking through the physiology, especially with hormones that are causing insulin resistance, I feel like women all of a sudden just feel like, oh my goodness, now we can fix it, but I don't need to feel that shame.
And
Yeah.
it's a snowball effect too.
Mhm.
You have less energy, so you work out less and then you gain weight. And then again, it becomes a blame. Like, well,
Absolutely.
yeah, I really haven't been putting the effort in, but gosh, I'm so tired that it's hard to put the effort in. And then you've got hormones that are fluctuating that usually help to sustain insulin sensitivity for a certain part of the month and give you enough leeway to work out at a higher intensity versus other times of the month that have hormones that actually, they're supposed to slow you down and kind of prepare your body
Right.
for a potential pregnancy, which is clearly not where you're at in perimenopause. But
Right.
all of that fluctuation, and now you've got hormones that make you resistant, and then you're fatigued, and then you add weight, and that makes you more insulin. Like, it's a snowball.
So your cortisol levels are going up, and the cortisol levels affects your insulin resistance. And then, as Dana said, that affects your body composition. And I've had numerous people coming to me and saying, I used to do this sort of exercise, and this is what happened. And then now I'm doing the same exercise, or the same activity, and I'm not getting the same results. I can't just jump out of bed in the morning and keep
And
going.
go.
It doesn't work.
Yeah.
Mhm.
And I wish that these things, so this is one of the things we've talked about amongst ourselves, is I wish that this type of experience and the rationale behind it, the tie in with the hormonal changes, I wish that there was a class or something that we had to take as women at some point in time, well before this starts kicking in, to say, hey, plan ahead. At some stages in your life, these are some things you can expect. It's normal. You're not failing as a person. Here are some things you can do to improve your insulin sensitivity, increase your energy levels, get better quality sleep. These symptoms, there's a whole bucket of them. Take a look through. If you start noticing them, go ahead and reach out to these types of doctors, because this is the other gap is
It
once you start
It's
noticing
a
these
huge
symptoms,
gap.
who do you talk to? Because you could talk to your endo because it's hormones and it's your insulin. You could talk to your GYN because it's female parts, right? Like, you could talk to your PCP because it's your overall health. I could talk to my sleep specialist because I have a sleep disorder. We could maybe monkey with my sleep meds. I can talk to my rheumatologist because fatigue and joint aches, right? What do?
But don't
You
you
talk
think up
what?
until recently nobody wanted to talk about HRT. I mean, there was this huge
It's true.
black warning, and now things are kind of reversing. I think the statistic, and someone will need to fact check me, that only 5% of women who could or should be taking HRT were. And I think, and so hopefully that is going to be changing, at least for women who would benefit. Maybe not everybody would, but it would certainly be nice for access to expand.
And I think it's the proper timing of when you add that HRT as well and what it is, and really having a practitioner who knows dosing and how to follow your symptoms and help you, because every woman responds a bit differently. What works for one is not going to work the same as another, despite being the same age and same like energy level and the same body size or whatever. Your reaction and what you need is going to be different, but you need somebody who can help follow that for you,
Correct.
but also ties in with the diabetes part of it
Right.
too, and help you to spot a trend or an adjustment that might be something that's needed. And, despite endocrinology being a hormone sort of specialty, I will tell you that the number of endos that I see people working with who know enough to actually be able to help with HRT, many of them kind of wipe their hands and tell you to go
Agreed.
to gynecology and say, this is their realm. It's the lady parts. So you go on to the specialist there, and sometimes they don't know the diabetes angle.
Well, I was just going to say, so many of gynecology offices really don't want to work with type 1 diabetes and don't really appreciate the impact of those hormones
Sort of
on
falling in the
insulin.
middle
If
and
done improperly.
You're falling in the middle. So, I mean, in terms of the HRT, I think finding somebody to help is valuable. And there are multiple different options. And I know you guys have all delved into them somewhat. Yes.
Well, and I think now there's so many more resources. I think there's a
There are.
menopause society where women can find support in their area. I know there's online telehealth services
Yep.
that I think are more supportive. So I'm so hopeful for the future in terms of changing kind of the impression that women get and have.
And I think, Jenny, you brought up a very important point earlier about how women talk to each other. I think that's one of the strengths of women, is that we bump into each other in the school car park or in the grocery store or something like that, and we like to talk.
Yes.
I think sharing feelings and sharing experiences is really helpful. Obviously, not everyone has the same experiences, but if you start to hear, oh, these people have these symptoms or these experiences, or they're getting these feelings, or this worked for them or this didn't work for them, it kind of normalizes to a certain extent what's going on, and helps you to seek help for it and get the right treatment.
And to find a practitioner, especially if there's somebody, like you said, you run into them in the grocery store, they live in your area. And if they have somebody that they've been very successful with getting help from, it helps open the door from even a standpoint of like shopping around for a doctor. It takes a lot of work.
It does.
To
It's
shop
and time,
around.
right? And that's
And
time you're
money.
losing. Yeah.
Right. So
I was thinking earlier about two pieces of this conversation that I think are really important for us to bring forward. One is there was some old research, very old research, that leaned towards there's a higher risk of blood clots leading to stroke in women who take hormone replacement therapy. And then because of that old research, a lot of providers just said, diabetes, it's out. It's too high risk. We're done. Thankfully, that research has been revisited and re-looked at. And it turns out what they found is that you don't want to take synthetic hormone replacement. You don't want to take more than your body needs. And you don't want to take it if it's not taken in a balanced way for what your body's needs are. So for example, you wouldn't want to start on like the highest dose of every HRT component starting on day one. That wouldn't make sense for anything anyone would ever do for any health condition. So that makes sense. And synthetic, right? So if we fake ingredients or manufactured things that have things in them, additives, things that we don't need, that's usually not what our bodies need for balance in any arena. And specifically, that's been shown in the research. It matters what type of hormones and what the ingredients are as far as for increased risk for blood clots and stroke. And that's a very important part for us to bring forward so that people can do their research before just taking something that someone might be willing to prescribe to make sure it's the right thing for people with diabetes, because we have a higher risk of, even if we do a great job with all of the management, parts of diabetes, we do have an inherently higher risk for coronary artery disease, cardiovascular disease, and we'll get back to bone density because that's a whole nother.
Right, right.
And so then if you add that inherent higher risks piece because you live with type 1 diabetes or type 2 diabetes, then when your estrogen levels deplete, you become at a much higher risk for cardiovascular disease. And so someone needs to tell us this stuff ahead of time. So it is really important that we find ways to get rest, quality rest, and exercise regularly and eat overall in a healthy way while still enjoying fun foods, right? None of us are robots. But we need to do that because we need to mitigate our risk factors, and we need to do that, and we need to be aware so that we're getting screened. I can't
Right.
tell you the number of people I talk to who are in this age bracket that don't have adequate cardiovascular screening in place. They haven't had a bone density test because they're not age 65 yet. That's late because we already have these baseline risks, and we know what happens if you hit menopause. That estrogen goes down and the risk goes straight up. We shouldn't be waiting.
Think Like a Pancreas, the podcast, is brought to you by Integrated Diabetes Services, where experience meets expertise, passion meets compassion, and diabetes care is personal because we live it too. Our team of clinicians, all living with type 1 diabetes, understands the challenges firsthand. We're here to help no matter where you are in the world. From glucose management to self-care strategies, the latest tech, sports and exercise, weight loss, type 1 pregnancy, and emotional well-being, we've got you covered. We offer consultations in English and Spanish via phone, video chat, email, and text. Want to learn more? Visit integrateddiabetes.com or email info@integrateddiabetes.com to schedule a consultation.
I was lucky enough to have a provider who was all about prevention of bone loss, prevention of rising lipid levels. And my grandfather actually died of a blood clot. So we went ahead and tested my risk factor for that before starting anything. And I do think I was in a lucky situation. And I just hope that people listening to this would be educated and find a provider who also would support them in those prevention efforts. I think that's a
Well,
great point.
that's definitely the prevention is
Yeah.
as you're both talking about it, and Tavia, you got around to is really the idea of the studies you brought out and the risk of stroke and stuff. It actually comes from an age group that was not likely to be the appropriate age to start the HRT to
Right.
begin with. So
Right.
now that backs up the idea we need preventative idea. We need to talk about this sooner and the potential of when these symptoms first show up. That's you probably would do well starting some type of HRT, depending on other risk factors and, health stuff going on. But this is the time of prevention leading into now I've hit menopause and now I'm postmenopausal, which is just a weird word to me. Like, what are you menopause one day and now you're postmenopausal? It's like the
Just
weird
another way
word.
of saying old.
Right.
Right. I get anyway.
But I heard something the other day. If we talk about cardiovascular health and prevention and that sort of thing, someone said to me that once you get into your 50s, exercise and physical activity is no longer an optional extra. It's an absolute, have to have and must
A
do.
prescription.
It's a prescription, absolutely. And I think a lot of people, you kind of get away in your 20s and into your 40s with just being vaguely physically active and, eating kind of what you like, and it doesn't really matter, and you get away with all sorts of things. And then suddenly you get to the end of your 40s and your 50s and you're like, oh, this is not working anymore.
People always seem surprised, right? Well, I mean, I was, low weight in high school and now I'm not. And, people are so surprised about that.
Right. Well, and even from a women's health standpoint, when you look at where do we build the majority of muscle mass and strength, it's up to about the age of 30, 35 at the most. And because muscle mass and strength and stability, flexibility all tie in,
Balance.
and balance, they all tie into bone health. If we haven't focused in our earlier years, well before anybody is talking about hitting perimenopause or menopause, if we're not focusing early enough on building the structure to maintain, we're really behind by the time we get to noticing symptoms.
Absolutely.
Yep.
And people with type 1 diabetes, we don't lay down new bone at the same rate as we should. We don't do well enough in that arena. Just it's a physiologic change in our bodies compared to people without. And so we already we're behind the curve of the general population just as a statistical statement. And so we really need the weightlifting and strength training and things that will help put pressure on those bones to strengthen them. We need that. We need adequate, and we need to know what it is, adequate calcium intake and vitamin D. We need to much is right for food consumption and for supplementation if you're not adequately taking in enough.
And I would also add protein intake to that
Right.
list
Yep.
of things as well.
You know what I often think about type 1 diabetes? Is it really, I mean, it's not a great diagnosis. And if you're going to pick one out of a hat, probably don't try not to pick it. But because it's got an overall encompassing overarching over your entire body, it kind of forces you to pay a lot more attention to your health that other people don't get forced to do.
Right.
And I often
True.
think that it's in a weird way almost an advantage because you're forced to pay attention, you're forced to eat healthier, you're forced to exercise and be more physically active, you're forced to look at all these other different things that go on in the
Early.
body
Mhm.
at a stage, yeah. And I think, perhaps if, I don't know, if we can encourage people to just have a mindset sort of shift a little bit and to embrace it and to look at it more positively and say, this is giving me the opportunity to pay more attention to my health and well-being. And I think for me, that's a really important thing to just pay more
I
attention.
certainly think that could be a silver lining for sure, taken with the right attitude. But I always am nervous that folks don't have access to the right information and resources to go in that direction. So I
Yeah.
know that we like to try to steer people into that higher knowledge sphere.
Right.
Yeah, absolutely. There's still a long way to go with getting type 1
Mhm.
diabetes management well organized. That's for sure.
Right.
Yeah.
Paula, early on, you mentioned kind of the weight component that ties into sort of this time of life, this perimenopause, where things shift and they shift out of what someone might have been doing as their strategy. So, are there some things that you know that you've done yourself or that you've worked with some of your patients in terms of navigating that weight management part that can help with this time of life?
So I think just as we've been chatting, we've already mentioned there's the sleep disturbances that come along with perimenopause that increases your cortisol. That's going to affect your weight management. The drop on estrogen, that's going to affect your insulin sensitivity. The increase in progesterone, that's going to affect your insulin resistance. So all of those things are sort of impacting on the weight. And then as Tavia also said, it affects your bone density, so it affects how you can exercise. So it's from multiple levels that your weight is being targeted. Dana always likes mentioning protein, and it's an absolute win-win in this sort of life. And I think, like I was saying earlier, just not getting away with what we used to get away with. You used to be able to not do so much exercise and snack when you wanted to. When you hit perimenopause, that's probably not going to be the case. So I think it's just a matter of trying to streamline those things. I was actually just chatting to a lady this morning and just saying to her, just try and get a little bit more routine. Don't keep those snacks and high-fat foods in the house. Then they're not there to tempt you. Try and adjust your calorie intake so that you're having a few more calories in the earlier part of the day rather in the later part of the day. Don't just keep going and doing more and more gym and more workouts, and it's not working and you're not winning. And then obviously you check your hormones and get the hormones tested and make sure that if you need hormone replacement therapy that you are stabilizing those hormones as much as possible.
Right. I think one of the biggest things that I've done help wise, just from a weight stabilization, has been the concept of fasted exercise first thing in the morning. What I've found is that has been probably top of the pyramid in terms of my own diabetes management. It keeps my morning running really nice and smooth. Also, some intermittent fasting with the approach of also making sure my meals and even snacks in between are much more to the protein and very low glycemic, when that is in a meal, because it mitigates a lot of the resistance factor. That first thing in the morning, getting your body moving and up and everything, it really helps to keep that stability with some sensitivity in the picture. So that's something that I've found is very helpful.
Well, and I know this is probably a little bit easier said than done for a lot of people living with type 1, but eliminating low blood sugars as much as possible, I think is, first and foremost that we need to make sure people aren't dumping insulin because they're finding themselves insulin resistant with the change of hormones and then having to eat their way through these lows. I find that can make a big difference too.
Definitely.
Yeah.
I think the food component of it also becomes harder with the ups and downs and
Yeah.
the more roller coaster, the lows. You may have been really good at treating with just 2 or 3
Right.
grams of carb, and then in
And
comes
then
something else
or
hormonally.
just frustration, right? I mean, the coping mechanism and the stress and just emotional eating, I think, can absolutely lead to cravings.
Yeah.
One thing I also wanted to comment on about in terms of exercises, I think the strength training versus cardio training kind of flip flops. In my mind, that kind of is what has happened personally for me. I have now a real focus on strength training versus just burning, at spin class or running or whatever that cardio is.
Yeah.
Previously, people said like promote the cardiovascular exercise, and people were just sort of spinning until they spun right out
Absolutely.
the gym.
Myself included.
Yeah, well, adding the exercise that's more weight bearing and or resistance training, even as easy as like I've really, really taken in the past year, especially more interest in my yoga classes from a flexibility and stability and my own body weight as used from a resistance standpoint. Classes are a little bit more, you have a little bit more opportunity depending on maybe the studio or the course that you take online. Some of the classes include some of the flexibility, but they also include some of the weights and or the resistance bands and things like that to add in, and it can make a really nice difference in overall just sensitivity.
Sometimes just as easy as putting ankle weights on when you take your dog for a walk. I mean, there's definitely easy things that we can do to add that strength training piece. Doesn't have to be
Right.
just going to a gym.
And I like to do things in my home. I'm totally a homebody, right? So I like to do Pilates at home. There's all kinds of apps and web options available, and I like them because they are structured, they're planned out, there's a time frame around it, and they have different categories. So if you want to get hot and sweaty, or if you want to do core strengthening, if you want to focus on one part of your body, like you can pick the course that's on that realm for the week or whatever that you're focusing on. It doesn't get boring, and I can do it in the morning before I eat. And it's been really lovely for me to fall into that. And that's been a shift for me from before I was in perimenopause. I really liked walking. I really liked biking. I really liked swimming. I still like those things, right? But now I'm focusing more on the Pilates side of things. It's helping with joints. It's helping with just strength overall and getting that muscle mass back again, because I've always been very muscular and I'm not now. And that very much bothers me. I don't feel strong. I don't look strong. And that is a shift in it's probably been like 7 or 8 years, but definitely the last 3 to 5 years for me. And that's really important to me because it's how I feel, it's how I looked, but it's also impacting diabetes management. And I'm thinking about my bones and my heart. Like this is where it's at.
On top of all that, the yoga and the Pilates actually helps your emotional health as well. And I think what we were talking about right at the beginning, just taking on a slightly slower pace in life. We all run around doing all sorts of things. And I think we would all do a whole lot better if we just carved out a little bit of time for ourselves, got our cortisol and the stress levels down a little bit. And I think for me, that's one of the biggest pluses of doing that sort of exercise and just menopause in a slightly better way.
And that's the reason that I like my morning fasted exercise, because I've found and have always found it's an easier time to navigate the diabetes angle. I don't need a change of anything at all unless I'm going to do something more endurance type. And it's also my time of the day. Nobody else is up. I have no other responsibilities than me at that time. Whereas later in the day, I used to be, when we had a gym membership, which we don't anymore, but it was like the afternoon and I could drop my boys off at like the kid care center and I could go and do but now they're like more elementary, middle school types of sports and things that they're in. I don't have time to fit that in with doing all of the other things. And then dinner time comes, and then evening time, other work things come in the picture, volunteer types of things. And so if I get it done in the morning, it's already been scheduled in and nothing else takes its place.
Right.
And scheduling it in so that you have to do it and you're committed to it.
Correct. I'm committed to it. It's done.
What do you guys think? I'm going to switch gears here because it's been on my mind, and we were talking about this a little bit the other day. What do you guys think the impact on diabetes management is once somebody hits the infamous menopause day? Do you guys think that hormones are just absent and
I really
glucose
hate
is more
the
stable?
idea of their one, 365 day from your last period
Yep.
as menopause, right? It is such a spectrum in the way that we think of so many things in health as a spectrum. And so I love the idea of perimenopause just because I think it gives women the idea that there's a lead up time, there's things to manage, there's things to do. And then menopause is also a time period, not a day.
Yeah.
I find that
I think
really frustrating for a lot of women because they're like,
Absolutely.
no, I don't have cycles anymore because last year on this date, I hit menopause. And I'm like, but look at your data. Look at the last 3 months. You can see this insulin
Absolutely.
resistance shifting.
Mm.
Those are hormonally tied.
It's not
Yeah.
like all of a sudden hormones as of menopause day 365
Right.
are just completely flushed down the toilet. That's not true. We're not absent entirely 100% of any of these hormones. It's just the fluctuation that moves us into a time where no longer are we able to have children and we don't have a cycle visible. But you're right. I see a lot of people too, frustrated women that come and say, well, I've been in menopause. I'm postmenopausal for 5 years, but I've been
Right.
tracking enough, and my doctor tells me that I'm crazy, that there is
Yeah.
no cycle left. I'm like, well, there's a cycle. It's just that you don't have a visible cycle.
Right, right. But that also kind of highlights the lack of tools that women have for monitoring and tracking all of these things. And I know that's something that we've all really talked quite a bit about. And there are some ways to track things, and hopefully there will be more in the future.
Yeah,
Yeah.
absolutely. Bringing it all together in an app would be lovely.
Would be.
So I think one thing we're clearly all good at is talking. Looks like our time is getting close on ending. Do you want to have just a quick whiz around one little parting comment before we close out? Any last thoughts?
Do you have a last thought, Paula?
Yeah, I just think having conversations like this are so important. And I think just talking about it, sharing experiences, and just getting other people involved in the conversation is really, really important.
That's actually what I was going to say, because having both Dana and Tavia to talk to has been very helpful, not only from a personal standpoint, but also because we are clinicians together and we have that a bit more like elevated knowledge about looking at things. It's nice to be able to text and bounce ideas. So if you can find somebody who is in a similar stage with you, it helps you feel not so alone in what you're seeing and the frustration that can sometimes come with that.
Yeah, I'm just going to piggyback that. Type 1 diabetes can be extremely isolating in general. And then you add on another kind of new chapter. I think that finding community is and support in, whether professionally or personally is so key.
Yep, agreed, 100%. And I think anything that you can do to find good quality information, not just whatever Google might say for the day, but working with knowledgeable healthcare providers, reading books, reading research, and working with providers that are up to date on research and sharing what you learn with other community members is going to help. I think if more people had done that, Jenny, Dana, and I wouldn't have been like, what's happening in our lives as much, right? Where do we start? We started fresh, right? We all
We
had
did.
to research and we all had to ask questions and we all had to send back everything we learned to each other because it was all
Absolutely.
new for the first time. And it
Yeah.
shouldn't be. It's
No.
something that happens to every single female. So it
Yeah,
shouldn't be
absolutely.
new. So anything we can do to help each other. And if you're doing it by yourself, stop doing it by yourself if you can help it. Go online, call a friend, whatever. Don't do it by
Yes.
yourself.
So I think we should have a menopause discussion part 2, and we have it on a Friday evening. We bring our glasses of wine with us.
Great.
Sounds great. Sign me up.
Sounds like a good idea. Thank you, everyone. Thank you for your time, ladies. Thank you to everyone who's listening. And if anyone feels that they want to benefit from chatting with any of us further about your diabetes management, about weight management, about exercise, hormonal regulation, please contact us at IDS, either via the website or email. And if you call in the office, you'll get a very friendly Amy who's not menopausal at all. She's really friendly and helpful and young and on the ball and super organized and super motivated and never forgets a thing. And we look forward to sharing our experiences and our knowledge and our clinical expertise with you in the future. Thank you, ladies.
Thanks for tuning in to Think Like a Pancreas, the podcast. If you enjoyed today's episode, don't forget to like, follow, or subscribe on your favorite podcast app. On behalf of Think Like a Pancreas, the podcast, I'm Gary Shiner, wishing you a fantastic week ahead. And don't forget to think like a pancreas.